Welcome everybody to our February's Meet the Expert. It's so good to have you here, and we are so excited to welcome the Orlando VA team from the Whole Health Department. So we are extremely appreciative of their time today joining us on this webinar. I hope all of you gain some insight as they share their expertise as it relates to heart health and just health and well-being in general. So I'm going to do a brief introduction of the team, and then I will go ahead and pass it off. But before I do that, just a couple housekeeping items. You are on mute when you join. So if you have any questions that arise, or you want to ask the team any questions, or you have feedback, feel free to put that in the chat box, and we will go through those questions or as many of them as we can at the conclusion of today's presentation. And then if you have any technical difficulties, please reach out in the chat box as well, and we will try to monitor that as best that we can. This will also be recorded so that you can share this with your colleagues at the end of the presentation, or view it again on your own time. So without further ado, I am happy to introduce the Whole Health team from the Orlando VA. We have Dr. Gerald Monk on the line, Lizette and Ashley Rush, who will be facilitating our webinar today. So I will go ahead and pass it off to them for introductions.
Hi, so we're from the Integrated Health and Wellness Center from the Lake Baldwin Clinic, which is a part of the Orlando VA Healthcare Center. My name is Ashley Rush. I'm a licensed clinical social worker and a certified HeartMath professional. We also have Lisette on the line.
Hi, I'm Lisette Shanghai, and I'm a registered nurse as well as an advanced holistic nurse.
Hi, I'm Dr. Gerald Monk. I'm a chiropractor in the VA Center. I'm also a board-certified chiropractic acupuncturist. So I'll be talking about acupuncture and acupressure for a little bit. So, yeah.
You want to go to the next slide?
Sure.
So today we're going to be talking about adding heart to your health. And, you know, as the quote says here, sometimes the heart knows things that the mind could never explain. And so part of what our heart does is to help us self-regulate. And so if you guys are like many of our patients, they're very techy, and they use things like the Apple Watches and the Fitbits to monitor their heart rate. So if any of you have any of those devices, you're more than welcome to use those to monitor how you're doing today throughout the activities. We're going to be doing 3 different activities today. We're going to be doing HeartMath biofeedback. We're going to be doing acupressure with a focus on the heart meridian, and we're going to be doing a loving kindness meditation. We know from research that using self-regulation skills actually help with overall well-being, and focusing on the heart actually helps us with a bottoms-up approach of managing our parasympathetic and sympathetic systems. So when we balance those systems, we actually have better energy management. We're also more resilient, and we're actually able to focus on tasks and able to get more work done overall because we actually feel better about the work we're doing, and we feel more rested when we're not working. And so that's really why we focus a lot on taking care of our heart overall. It also changes how we respond to things emotionally. So it's not just about how we mentally respond, but it's also about how we feel about our responses and how things affect us in the long run. And we know that overall stress actually brings us down. And so we want to make sure that when we're doing things for our wellness, that we're taking care of ourselves, not just our minds, but also our spirit, and then our bodies overall will flourish because of the care that we're taking and the time that we're taking to allow ourselves to rest and recuperate. Next slide. So HeartMath biofeedback is a special kind of feedback that focuses on this balance called coherence. And so that's when the heart, mind, and emotions are operating in sync and balanced, but it's also focusing on this idea of energy reserves and resiliency. And so it's a little bit different than maybe some other techniques that are focusing on how you can change your mind and balance the parasympathetic and the sympathetic system by getting the chemicals from a top-down approach, because then this one is focused on heart-focused breathing. And so that's really the baseline for this. And it says that when your heart, mind, and your emotions are in balance, your physical, emotional, mental, and spiritual aspects of your life will all be in balance as well. And then your energy will also balance itself. And so you'll feel more fulfilled overall when your energy is balanced overall in all those domains. And so this one, it really leads to feeling appreciation. It leads to a better attitude overall. And then it also believes that what you're putting out is going to affect those around you because it affects the energy fields around you. And so that's what it's saying down at the bottom is constant energy expenditures without the balance of adequate rest and recovery can lead you to have higher rates of burnout, errors, health challenges. So that would be things like, hypertension, diabetes, cardiovascular issues, overweight, because a lot of the times our cortisol levels can affect how our weight is, and then diminished performance because cognitively you just feel fatigued and foggy when you're not taking care of your energy reserves. So if it's okay with you, I'd like to lead you in a HeartMath breathing activity. It'll be short, but I would like to just show you a little bit about what HeartMath is. Next slide. So I'm going to invite you to go ahead and just take a look at this chart of unwanted feelings or attitudes. And recognize a feeling or attitude that you would want to change, and then identify a replacement attitude. What would you rather feel? And you can choose an attitude or feeling you'd like to replace it with. And you can use that chart that's on the screen, or if you've been feeling stressed, you could rather feel calm. If you've been feeling overwhelmed, you could consider rather feeling ease. Or if you've been feeling judgmental, consider replacing it with a feeling of kindness or compassion. But allow yourself to choose an attitude to replace the one you've identified. Or if your intuition brings you a word for replacement, you're more than welcome to go with that. Allow your eyes to drift softly closed or gaze off in the distance, and focus your attention on the area of your heart. And as you're breathing, find an easy rhythm that's comfortable. Imagine your breath is flowing in and out of your heart or chest area. Breathing a little slower and deeper than usual. Allow yourself to breathe the feeling of that new attitude you've chosen slowly and casually through your heart. And as you continue this heart-focused breathing, feel that attitude within your heart area. And just stay with this breathing until you start to feel the shift. And now notice that you can practice maintaining your new attitude and perceptions you've cultivated as you move through your day-to-day interactions. You can use this breathing easily on the go, and you can reset your replacement attitude as you notice it start to fade throughout the day. You can notice this as something quickly and easily that you can do on a regular basis throughout the day. And any of these attitudes that you feel coming up for you, you can easily and quickly replace these feelings for yourself. So thank you for participating with me. I'm going to go ahead and let Dr. Monk take over from here and show you how to do acupressure with your heart meridians.
So I'm going to talk about acupressure and acupuncture. They're very similar. The difference is that, like you've probably all heard of acupuncture. Acupuncture uses a needle, and the needle punctures the skin. Acupressure is different because it uses just pressure, pressure by, your finger, or you can use like an eraser on a pencil, or you're just using a device to put pressure on your body to activate the point. Acupuncture, like you've probably heard, it's an ancient art of healing. It comes from China. It's approximately 2,000 to 3,000 years old. When they first started, they started using fish bones in China to use, instead of a needle, they used a fish bone and so forth to press on the points. So again, the definition of acupuncture, it's the application of pressure, as with the thumbs or fingertips, to the same discrete points on the body stimulated in acupuncture that is used for its therapeutic effects, such as the relief of tension or pain. For example, perhaps when you were young, if you would fall down and you would get hurt, you would hold your arm or hold your leg and put pressure on it, and that would help the pain kind of relieve. That's the same idea. So you're activating the body's healing system by pressure. Next slide, please. So on this slide, you can see there are highways. There are different lines on the body, on the side of the body, the front of the body, and the back of the body. And these lines are pathways. They're called meridians. And these are not like the blood vessels or the nerves. These are pathways that carry energy. And the name of energy in Chinese medicine, they call, the Chinese refer to that as qi, C-H-I or Q-I. In the Indian world, it's called prana, if you like in the yoga world, but we'll go with qi right now because we're studying Chinese medicine. So all these lines represent different organs. If you look in the middle picture at the back, right down the center of the back, those parallel lines in the center of the back that run up and down, those for example, are the kidney. The kidney meridian hooks into that, and the bladder. And if you have low back pain, the Chinese acupuncturists will put needles in the low back areas and so forth. And anywhere in that pathway, you see the line running down the leg to the back of the knee, down to the ankle. So you could use any of those points to treat low back pain because that line is all connected. And again, these different lines represent different organs. Each organ has its own pathway or line on the body. And what's unique is that these pathways connect each other. So the heart connects to the pericardium, it connects to the small intestine. Every organ connects to every organ, all the other organs. There are energetic connections. So if you have a problem with one organ of the body, you can treat the other organ to cure one organ. For example, the bladder helps with the kidneys. The lungs help with the large intestine. So this is just a map, or it's a pathway that we use to activate points. The point that we want to talk about today is the pericardium. Next slide, please. So to truly activate the heart and affect the heart, you want to use points directly with the heart as far as the pericardium or the heart channel. In Western medicine, the pericardium is like a sac. It protects the heart, it surrounds the heart. And in Chinese medicine, A lot of times, if they want to affect the heart, they'll use the pericardium channel. That will do a lot of things to change the way it is, to slow it down and so forth. PC6, or it's called Miguan, the translation is inner pass, because that inner pass goes directly into the heart inside, and you can activate that directly. The action of it is to unbind the chest and regulate the chi. This point is the command point for the chest. All pain and trouble with the chest, this point will directly affect that directly. It regulates the heart, it calms the spirit, it helps you relax. It also is good for the stomach, it harmonizes the stomach. If you have a lot of heat or fever, redness, it will help to clear the heat. It helps to take a fever out of the body. It's also a good point for nausea and vomiting. When you're getting anxious or nervous or you feel sick, or if a female is pregnant, it's good for that. It helps calm that down pretty quickly. So you find that point by putting approximately 2 fingers on the crease of your wrist, just like the picture, and the point will be on the outside, outside the finger. You can also run your finger down the center of the wrist. There's 2 tendons. You'll see them, the 2 large tendons. They're in between the tendons, and at about 2 inches or so, there's a dip. If you run the finger down the tendons, there's a little bit of a dip. It'll just fall in that little dip, and that's what you want to press. You don't want to press hard so it hurts your body, but you want to have firm pressure. And you can activate that when you're feeling anxious, you're feeling tense, you have nausea or anything. That'll help calm it down pretty quickly. It'll help slow the heart down also. In Chinese medicine, they believe that the mind rests within the heart. So if you calm the heart, you calm the mind. So this point is very, very powerful. So just if you want, you can practice. We'll just do this for about 30 seconds or so. If you put your finger on the crease of your wrist in the center, run it down about 2 inches, and then find that little dip and hold that point. And I'll just give you about 30 seconds. You can breathe very slowly and just press firmly on the point. You can massage it or press firmly, and then you can see how you feel afterwards. So we'll start now. Okay. About 5 more seconds. So it's possible, maybe some of you have felt the body's the shift slow down a little bit, but that's kind of how you do that. And again, I would recommend 3 to 5 minutes when you do that. You can do that once a day, maybe at noon, maybe at a break between lunch, at lunchtime, when you want to kind of calm your mind down and kind of reboot your system, and that's good to do every day. So that's about all I have for that. And thanks for your attention. So now Lizette will talk about loving kindness meditation. Thank you.
Thank you. So loving kindness meditation is an ancient practice, actually originating in South Asia and brought to the US by various meditation teachers you might be familiar with, Sharon Salzberg, Joseph Goldstein. And so it ties in very well with the self-regulation component that Ashley spoke about, also as an adjunct to an existing self-care practice. So we practice to have more grace and resilience to meet ourselves in the moment, the now moment. And we also are working to develop compassion for ourselves and others in this process, even in times of turmoil. So I'll invite you to relax and get centered in your seat. You can also lay down doing this practice. And we'll start by repeating some phrases that are on the next slide, and I'll guide you through them. So this is loving meditation, loving kindness meditation for ourselves and others. Next slide, please. So you can close your eyes or not. Again, you can be seated or lay down. And just repeat the phrases to yourself as we move along. May I be safe. May I be happy. May I be healthy. May I live with ease. Repeat these phrases with enough space and enough silence so that it's comfortable for you. Try to gather all of your attention behind each phrase at a time. Don't worry if you find your attention wandering, that's normal. And you can simply just let go and begin again. Feelings may come and go, memories may come and go. Just allow them to arise and pass away. Here, the touchstone is the repetition of the phrases, so you don't have to block anything out and you don't have to follow after it. May I be safe. May I be happy. May I be healthy. May I live with ease. Now call to mind someone who's helped you, who's been good to you or kind to you. Maybe you've met them before, maybe you haven't, but they've inspired you. If someone like that comes to mind, bring them here. You can get an image of them, say their name to yourself, get a feeling for their presence, and offer these phrases of loving kindness to them, wishing for them what you've wished for yourself. May you be safe. May you be happy. May you be healthy. May you live with ease. You can let thoughts, emotions, and memories arise and pass away without clinging to them, without condemning them, judging them. Just let them come and let them go. Your attention can steady on the repetition of these phrases. Just feel these phrases and call to mind someone you know who's hurting, someone who's having a difficult time. Bring them here, get an image of them, say their name to yourself, get an image for their presence, and offer these phrases of loving kindness to them. May you be safe. May you be happy. May you be healthy. May you live with ease. If you find your attention wandering, you needn't be discouraged. Gently let them go and come back one phrase at a time. Now call to mind someone you might encounter now and then, a neighbor, a checkout person at the grocery store, someone you don't really know. Perhaps you don't even know their name. The first person that comes to mind. We call this a neutral person, and bring them here. Even not knowing their story, you can know that they want to be happy just as you do, that they're vulnerable to pain or loss just as you are, and you can wish them well. May you be safe. May you be happy. May you be healthy. May you live with ease. Then turn toward all beings everywhere, all people, all creatures, all those in existence, known and unknown, near and far. May you be safe. May you be happy. May you be healthy. May you live with ease. Connect to the boundlessness of life in all directions. May all beings be safe. May all beings be happy. May all beings be healthy. May all beings live with ease. When you feel ready, you can open your eyes and just pay attention throughout the day to see how this meditation practice may be having an effect. Thank you for sharing this practice with me.
Thanks so much, Lizette, and the Orlando VA Whole Health team. Hopefully everybody has a sense of calmness that maybe they didn't have at the beginning of this webinar. I will go ahead and open it up to questions at this time. So if anybody has any thoughts, feedback, or anything they want to share with the VA team, go ahead and put that in the chat box. I guess I'll start. I know it is Heart Health Month, and meditation plays a big role, and mindfulness plays a big role in our health and our well-being. What, for somebody who, might be struggling to meet their physical activity goal, or may not be able to get, those 5 fruits and vegetables a day, how can mindfulness play a role in combating disease and illness in the body?
I'll start. I think that, in developing a mindfulness practice, you become more intentional about how you're living your life, and the things that you may or may not be doing to contribute to all areas of your health. So I think you really start to really kind of sit back and think, oh, well, maybe, I can make this small change, and really kind of looking, because, without that, then, a lot of us tend to be on autopilot, right? And there isn't that intentional component. So I think that mindfulness, or some sort of meditation practice, helps people to really start to examine different areas of their life and be more intentional, and to, like we said, be in your life instead of kind of more of a reaction and autopilot situation.
And I would take that one step further too with intentionality, is time is limited. So if you only have a limited amount of time to be able to focus on your self-care and well-being, be really intentional with the time that you put forward to it, and realize that there's different kinds of meditation. I know personally for me, sitting and meditating can be sometimes very difficult when I was first starting. And so realizing that movement-based meditations for myself were a lot easier to connect to. So things like Tai Chi and yoga are just as effective for that mental piece of meditation as well as the physical well-being. And doing something like Tai Chi or Qigong works all systems of your body. They help with balance, they help with hypertension, they help with diabetes, they help with your heart health, plus they have that meditation piece to them as well. So if you only have a limited amount of time to be able to target your well-being, because we have very busy lives, being very intentional in the types of interventions you're choosing to participate in, so you're getting the biggest bang for your buck in the time that you're spending on yourself during the day.
Thank you. Yeah, I think it's hard for a lot of us to stop and remind ourselves to be intentional, like Ashley mentioned, and Lizette, you kind of find yourself on autopilot a lot. So, sounds like you're just taking a step back and just acknowledging where you are, what your feelings are, just your life situation can help a lot with trying to meet your goals, or, trying to just become, I guess, a healthier individual. So, thank you for your insight. Kristen, is there any questions that came in the chat box?
Nope, I'm not seeing any questions.
Okay. Well, if anybody has any last thoughts, go ahead and throw them in that chat box. I'll give everybody a couple more seconds. But if not, I would just want to thank the whole health team from the Orlando VA once again for walking us through that exercise. And I appreciate your time. I will go ahead and share this recording and presentation with everybody at the conclusion of today's webinar, but I hope everybody has a mindful, healthy rest of your day and year. Thank you so much and take care.
Thank you, Rachel.
Yes, thank you.
Take care. Bye-bye, everybody.